Bipolar disorder is a highly complex illness, and each individual's symptoms and patterns of mood and behavior changes are unique to them. Mood charting is a way of recording and learning more about mood changes for both the patient and provider to better understand a patient's unique pattern or signature of their moods. Mood charting is a simple daily diary of your mood states, with dates indicating when moods start and stop. Depending on the detail put into mood charts, they can incorporate information about sleep patterns, medications and medication changes, as well as environmental and life stressors. They also can often reveal subtle patterns or changes that aren't readily apparent to you or your provider, especially as you look at many weeks or months' worth of mood charting. There are two basic options for mood charting. There is the older paper and pencil method, and then, of course, there are numerous apps that many patients find very helpful and convenient to chart their moods. Let's start by looking at the paper and pencil method, since this is what the electronic versions were essentially based on. This is the basic mood chart that was developed by Dr. Gary Sachs. Here we see the days of the month. We typically ask patients to think about their mood, usually at the end of the day, and place a mark as to how elevated their mood was that day, ranging from mild, moderate to severe, or how depressed their mood was. If their mood felt normal, we ask them to place a mark in the middle section. Patients can record how many hours they slept, how anxious they were on a scale from 0 to 3, and how irritable they were. They can add anything that may have happened that day that may have influenced their mood. There's also a section to record medications they are taking, which can be especially helpful if medication changes are occurring. Let's take a look at a real patient's mood chart to get a better sense of how this can be helpful. This is a mood chart from a patient who came in concerned about her depression. She has circled the days of her period, seen here in green. What is especially helpful in her mood charting is that it revealed she wasn't just suffering from depression, but had notable upswings in her mood that neither she nor her provider were aware of until she started recording her mood daily. This led to important changes in her medications, which ultimately helped stabilize her mood over time. For many children and young adolescents, constructing their own mood charts can be more engaging, creative, and fun for them, as is shown in this example. Phone apps are now the very common way that patients keep track of their moods. There are a number of very good apps available for patients to download, some free and others for a generally low cost. These are 6 commonly used apps and are available for both Android and iOS systems. Let's take a closer look at one of the apps, in this case eMoods, to get a better sense of how these apps generally work. In this app, patients select the days they're going to record their mood. They then can record how many hours they slept, how depressed they were, how manic, how irritable, and how anxious they were, if they experienced any psychotic symptoms, and any other aspects of their treatment. Most of these apps can then produce graphs showing variations in sleep and mood, which ultimately can be helpful in revealing mood patterns that might be related to environmental stressors or medication changes. In addition, several of these apps can produce monthly reports, often in PDF file format, that can be sent to the patient's provider prior to an appointment so that the provider can get a better sense of how a patient has been doing over time. This can help improve the efficiency and effectiveness of an appointment. So why keep a mood chart? Mood charts are an excellent way to detect subtle changes in mood and activity levels to help patients start to recognize early warning signs of a mood change and take steps to intervene. Catching mood episodes early then allows for things like medication changes to be made or initiating behavioral interventions to ward off a worsening of a mood episode. Providers find mood charting very helpful in getting a better sense and a more complete understanding of a patient's mood, especially over long stretches of time when remembering such variations can be difficult. Finally, mood charting can help both patients and providers identify important environmental triggers to mood changes, like work travel or school stresses, and point to ways to help manage these kinds of stressors. We do recognize that there are potential minuses to mood charting. It can be difficult for patients to remember to complete mood charting each day, and certainly when patients are doing well, they may feel that mood charting feels like a burden or is unnecessary. Some patients understandably feel that mood charting is overly simplistic or doesn't really do justice to the many varied experiences that patients have on a daily basis. And certainly some patients feel that their mood shifts and reasons for these changes can't be easily recorded on a chart or app. However, all of those things being said, most patients do find mood charting beneficial for both themselves and for their providers. Just a few tips for mood charting. Try to fill out your mood chart at the same time each day. We generally suggest that patients take a few moments at the end of their day to reflect on their mood and record their impressions. It's best not to pick the worst moment of the day to fill out your mood chart, as this may not give the most accurate picture as to what's been going on. If you forget to fill out your mood chart and are worried what your provider may say, it really is best not to fill out days' worth of mood charts right before an appointment. It's far better just to discuss reasons that you weren't able to fill out your mood chart. Keep a lookout for connections between changes in sleep or stress and other factors that may play a role in your mood changes. This can help lead to strategies to keep stress at a minimum or create other opportunities for you to help manage your mood. So just to summarize, mood charting is a very efficient way of capturing and summarizing a great deal of information over time and can reveal patterns of mood changes that might be otherwise difficult to see. It can be hard for patients to remember all the variations in their moods over weeks or even months. Mood charting provides a way that patients don't need to be over-reliant on their memory. It can be helpful for both the patient and provider to learn about influences on mood and what effect things like medication changes, sleep changes, and stress can have on their mood. And perhaps most importantly, it can help with early detection of mood changes so that the patient and provider can figure out ways to ward off future episodes.